Welcome back to Healthy Living. We are back to talk a little bit more about men's health, and I have with me, Bert Lindsey. Bert is our Director of Acute Rehab Services and Patient Mobility for St. Tammany Health System, and we're excited to have you here, Bert.
Thank you for having me.
Thank you for coming. We're going to talk about something that you're very passionate about, but first, I want people to learn a little bit about Bert.
I'm a damn Yankee. My dad was in nuclear power. We moved every 4 years, and when I was in the 8th grade, we moved to St. Francisville.
Oh.
And I had a bowl of chicken and sausage gumbo, and I told them right there, I'm never leaving.
Never looking back.
And I got emancipated. They went to Illinois, and I've never left.
Oh, good. Glad to have you here.
There I am.
Good. So what do you like to do?
I do a lot of things. I woodwork, I play music, but really my passion is still MSK ultrasound. I live and breathe it.
How long have you been with the health system?
I came here in 2012.
Okay.
I left after Katrina and did a walkabout and came back.
Okay.
This is right where I needed to be.
All right. Well, we do want to talk about men's health. And you guys your team goes out to so many of our outreach events.
We really do.
With the Musculoskeletal Ultrasound,
exactly.
MSK Ultrasound.
That's it.
So tell people, what is it, first of all?
So MSK Ultrasound is a subset of the regular other ultrasounds that are around. It uses the same equipment you would do to assess for pregnancy or for a gallbladder or vascular systems. But what we look at is soft tissue, specifically muscles, tendons, joints, ligaments, and things of that nature. The beautiful thing about it is currently, if you get an x-ray and it's negative, you go to a therapist, an orthopedist, or a trainer, and they'll do special tests and maneuvers to stress things, but you're really only 50 to 75% sure of what you're looking at. With the advent of musculoskeletal ultrasound, a trained clinician can see everything that's in there. So if there's no fractures, we can see tears, strains, ligament tears, bursitis, soft tissue issues. We trace nerves regularly to see if there's any issues with nerves, neuromas, schwannomas, things of that nature.
So if you get an x-ray, you see the bones, right? If you get the ultrasound part, you're seeing what you said, the soft tissue. Your treatment path could be different, right?
Yeah, absolutely. What the goal of the program for us, came out of the opioid initiative. So we were really strong into opioids, and the best way to stop opioid abuse is to just stop all exposure. And if you go to a physician or a family practice doctor or a trainer and they can't find a broken bone, you may be set on a course of opioids. And it may go on for several weeks because insurances do not like to authorize MRIs unless conservative treatments have failed. And unfortunately, opioids are considered part of those conservative treatments. So if we can get, in conjunction with a negative x-ray, some more material to the physicians, they can make a better decision on a course of action for treatment.
Right, especially if it is in the soft tissue.
Absolutely.
So we've talked about it so many times, and I've had an MSK ultrasound painless and fast, and you can see it. You can tell me in real time what's going on then and there. And
one of the other things we can do that you can't do with MR or CT is we can do video clips. So we can dynamically stress joints, move joints through the whole motions so that we can see things that sometimes people can't see. We can see any issues 2 millimeters. We can see structures 2 millimeters or less apart.
Golly.
So we can see a lot of stuff.
So when you talk about the MSK ultrasound as that next step, so if you have an x-ray and it's negative, how would you tell your physician, hey, can we try this instead of that? So can I try this treatment, this diagnostic tool MSK? How would you do that?
So we've been training all the physicians. We have the order sets in all of our facilities. But you would just call them, or when you discuss with them, just say, I've heard that we have this new ultrasound that looks at soft tissues for muscles and tendons, and it's called musculoskeletal ultrasound. And we do it in our outpatient clinics. Mike McNeil and his staff do a phenomenal job doing MSK ultrasound there, and we can do it in the acute setting. We can do it from our outpatient facilities in the hospital. We'll come down there and get the patients. and we just do the scan. As you said, it is painless. There's no restrictions for it, and it's a very cost-effective tool. And this way we can help appropriate if you need further imaging. And as I said, I tell the doctors all the time, we're just another advanced tool in your kit. We're a power tool, so to speak.
Right.
And because that's what doctors need to make informed decisions. So, and they're really taken to it. It's such a new concept. There's only 12 or 13 people in the entire state that are certified, and right now 7 of them work for us as therapists, and 3 more have just taken their boards.
So we have a little power team of our own.
We're concentrated in this area, and our goal is to get into men's health, women's health, sports, kids, club ball, all that. So, because it is very effective, and as you said, patients absolutely love it, because if they think they have an issue and an x-ray is negative, they feel like that maybe that it's not being taken seriously. But once they see it, even if it's just a small issue, then they get validation that they did in fact have a problem, and that's what we want. We want patient satisfaction.
And we have talked about in the past also that it saves you time, and time for me, that is truly the most valuable asset that I have. And how does it save you time? We went through it in pieces and parts, but tell people why it is a time saver, why it makes your treatment plan, possibly could make your treatment plan more efficient.
So we'll use the ER as an example.
Okay.
So when people come in and get a negative x-ray at ER, they'll call us and we'll come right down. Our scans take no more than 15 minutes. And then we can show them and the physician right there what the issue is. That way we can set them up immediately with we have some fantastic physicians and therapists at St. Tammany Health System. We'll set them up immediately, and within 2 to 3 days, they're now being seen with more enhanced knowledge of what's exactly going on.
So you don't have to wait for that x-ray to come back, or you saw the x-ray come back.
Right.
Okay, so you don't have to start physical therapy and wait to see, okay, if I do physical therapy, does it make it worse or does it make it better? You can say, okay, let's look deeper. Instead of just looking at the bone, let's look at the soft tissue too and rule that out.
Exactly, and a new aspect of it that's catching on across the country, specifically for therapy, is once you start to do treatments, you can use follow-up MSK ultrasound images to show the healing process.
Oh, wow.
It's also, all insurances pay extra if you use MSK ultrasound when you're doing injections, because they will know that you know where you're going with the injection.
So you can see your progress and know when you need to stop.
Absolutely.
You know, just treat and treat and treat.
Right, and you can get authorization for further visits if needed, because you've got extra baggage to show them.
Yeah. So why do you and your team go out and do the events that you do?
Because it's such a new technology, people don't know about it, and you've been there. When people see what they see, it's so much fun to see people see what's going on in their bodies. And I've been doing this for over 30 years, but I never really had the grasp of anatomy until I started this 5 years ago. Because everybody's different, but you get to see things that other people don't. But I, as an educator, it's phenomenal to watch people, especially when you find things that they know that they had, but they didn't know what it was.
Well, I think that is an important part of this too, because you said it. When you know that something's going on, but no one can find it.
Right, exactly.
When someone finds it, it's validation that, okay, it's not all in my head.
That's exactly right.
It's not something I'm moving wrong, or no, it's an actual issue that we can address now.
We've had people come to our hospital for multiple ERs, having multiple radiographs, and they'll get a scan and they'll go, I knew something was wrong with me. And it's non-invasive, and as I said, it's very cost-effective.
Non-invasive, cost-effective. Talk to your insurance provider for sure.
Absolutely.
Talk to your primary care, your orthopedist, whoever you're seeing, ask them about it. So how would someone get in touch with your team?
They can either call the hospital. Our direct extension is 898-4424, but if you call the scheduling line for radiology, or you call the outpatient clinics, all of our schedulers know that the service is provided.
Okay, gotcha.
And there's, right now, as I said, there's 7 therapists, PTs that are doing it. There'll be 3 more in 2 months, Lord willing. And then we'll have 10 total, and we're going to be everywhere. And we love the events because the units are portable.
Yes.
We actually have handheld units. We can look right on our cell phones and show you images right there.
It's amazing.
Its technology is phenomenal.
We are going to be right back, and we're going to talk some more about men's health, so stay tuned.